too easily overlooked. It needs only a little time and attention to get it right before you start, and then you'll avoid running into problems later on. The basic aims are simple: to firmly support the patient as comfortably as possible, whilst at the same time ensuring that their head is correctly positioned to allow for good surgical access. In this video, we're going to show you some straightforward, reliable and effective ways of achieving these aims. Firstly, you need to have a suitable operating table. The ideal table is infinitely adjustable to conform to every patient's body shape like a glove. In practice, you can get fairly close to this. There are now many tables available, such as this Stryker trolley, which have plenty of adjustment and can accommodate most patients with ease. On the base of the trolley, there's a hydraulic foot pump which vertically lifts the table. Next to it, there's a 3-action release pedal. This can lower either end of the table, tilting it feet down or head down as needed, or it can lower the whole table by depressing the central section. The headrest itself can be raised or lowered whilst keeping the head in the same horizontal plane, and it can also be independently flexed or extended for accurate positioning of the head. Finally, there are threaded levers that enable the bed to be hinged to provide lumbar, hip and knee flexion. This level of adjustment means that the table can firmly support nearly all shapes and sizes of patients, not only in comfort, but also in a position that gives good surgical access to the eye. The aim of adjusting the head position is to orientate the plane of the face parallel to the floor. As a practical reference, the chin and forehead should be in the same horizontal plane. To achieve this, for most people, usually needs gentle extension of the neck. This is particularly important if a superior surgical approach is used. In this position, the microscope sits perpendicular to the plane of the iris. This arrangement gives good coaxial illumination and the best red reflex. Head rotation should be either neutral, or it can be usefully rotated slightly towards the side of the surgery. This reduces the pooling of irrigating fluid around the medial canthus, particularly if there's a deep socket. In order to keep the head in its correct position throughout surgery, it's very helpful to wrap some adhesive paper tape, such as Micropore, over the forehead and around the headrest. Although this looks restrictive, it's not at all uncomfortable, and it relieves many patients of their anxiety about moving their head during surgery. And while we're on the subject of helpful tips, here's another one to help stop any fluid running into the patient's ear. Just tape a gauze swab in front of the ear like this, just below the lateral canthus. Make sure that the skin is dry, and also use a wide adhesive paper tape, such as Micropore again, to ensure a good seal and easy removal. This is simple to do and very effective in preventing fluid trickling into the ear, which can be irritating and cause restlessness during surgery. In most cases, positioning the patient on the table is relatively straightforward. It involves an initial adjustment of their head position that we've just run through, followed by a vertical adjustment of the table height to suit the surgeon. Unfortunately, many patients are not quite as straightforward as this and require some improvisation. Many cataract patients are elderly, of course, with significant arthritis affecting their hips and knees and often their necks as well. They have poor flexibility and sometimes musculoskeletal deformities such as kyphosis and scoliosis. The solution to these problems is that you have to take your time and pay detailed attention to the particular positioning needs of these patients. If you do so, then they'll be comfortable, pain-free, and therefore more likely to be relaxed and to remain motionless during surgery. So here are some basic tips to help you achieve this. In general, most people are usually more comfortable with a pillow placed under their knees. This produces slight flexion of the joint and gives more support. Low back pain is another common problem. This can be reduced by putting some simple lumbar support in place in the form of a rolled-up towel or similar padding. If you have an adjustable table, then you can put it to good use by adjusting it to give some additional hip and knee flexion, which is often more comfortable than having the legs out straight. Many adjustable headrests unavoidably have a gap between the headrest and the end of the table, which is the space that's there for adjustment. However, this can leave the neck unsupported and uncomfortable, so don't hesitate to fill it with some form of padding to get around this. It's also worth tilting the table so that the feet are pointing slightly down in a reverse Trendelenburg position. This not only reduces intraocular pressure and venous congestion in the orbit, but it also lowers the intrathoracic pressure from the weight of the abdominal contents on the diaphragm. This enables patients with any respiratory problems to breathe much more easily. So let's now see how all this is put into practice. Here's an example of an elderly man with severe kyphosis and a rigid neck, together with very deep sockets. He needs to be tilted feet up with his neck supported, and the surgeon has to sit temporally and obliquely in order to gain good access. It's not ideal, but it does illustrate that sometimes you have to adapt your own positioning and surgical approach because of the patient's positioning needs. Comfortable positioning of the surgeon is as equally important as that of the patient. If you're uncomfortable, then you're distracted and the surgery can become awkward. In the long term, musculoskeletal problems can result from a poor posture, particularly affecting the neck and the lumbar spine. The correct posture can easily be achieved every time by using a systematic and straightforward approach. First, you should adjust the height of the stool. You want your hips and knees to be at approximate right angles with the pedals comfortably in place under your feet. Next, swing the microscope into place and set it at the height which ensures that your spine is straight and that your head is in neutral balance with your neck neither flexed nor extended. When you've done this, you then adjust the height of the trolley. This coarse adjustment will bring the eye into fairly sharp focus. You can then make your final adjustments on the microscope to fine-tune the XY, zoom and focus. Everything's now correctly set up and you're ready to start. Like all the steps in phaco, positioning the patient on the table requires some careful attention to detail. It's important to get it right each time because correct and comfortable positioning of both the patient and the surgeon is critical for safe and successful surgery.